Hello, in this video, I'm going to tell you all about high ankle sprains. So what is a high ankle sprain? It's stretching or tearing of the ligaments of the syndesmotic joint of the ankle complex. So it's the inferior tibiofibular joint, and it can sometimes also involve the tibiofibular syndesmosis. So just to clarify, this is the most superior joint of the ankle complex and is not a synovial joint, so it is not freely movable. We're really just referring to the articulation or the joint made between the fibula and the tibia. So it's completely just joined together by this interosseous ligament or the interosseous membrane and the anterior tib-fib ligament and the posterior tib-fib ligament. Okay, so that's what holds the fibula and the tibia in place and what sort of connects them to each other so that we don't have too much displacement of the fibula relative to the tibia. So a high ankle sprain is when we have a sprain to any of those structures. So the anterior or posterior tib-fib ligament, and then sometimes also the interosseous ligament that is like a membrane that joins the two bones and runs all the way up and down the length of those bones. So this is the least common type of ankle sprain compared to a classic ankle sprain where you roll the ankle. So that's an entirely different type of ankle sprain. So this is much higher up and is not a sprain of any of the synovial joints in the ankle or foot. So signs and symptoms. So it's common for someone with this type of injury to hear or feel a popping or tearing at the time of the injury, and then it will immediately be difficult to walk. It'll cause limited range of motion in the ankle and especially pointing outward, so external rotation of the foot. It'll cause pain, tenderness, and swelling in the foot and the ankle and lower shin. And it could spread down to the entire foot. And there's bruising for sure that can spread to the heel or toes. So, like we see in the picture, the injury is up here where this bruising is. But there can be bruising, swelling, pain, all of that anywhere distal to that site of the injury. So, anywhere down lower in the ankle and anywhere throughout the foot. So the injury mechanism, there are a couple ways that this type of injury sometimes occurs. By far, the most common is forceful external rotation of the foot and ankle. And that could be that the foot moves externally, or it could be internal rotation of the shank or the shin. It's another name for that segment there. So that of the tibia and fibula. So it might rotate internally, or the ankle might rotate and the foot might turn externally, or it could be a combination of both. So it really just depends on which segment is fixed at the time of the injury. So like sometimes the foot might be planted, so the foot might be fixed, and it could be internal rotation of the tibia, or it could be that the tibia is fixed and it's external rotation of the foot. Also, hyperdorsiflexion can also cause this type of injury, and really any extreme forces that disrupt the congruency of the tibia, fibula, and talus can cause this injury. When I say congruency in reference to a joint, the congruency of a joint means like how well the joint fits together. So like a more congruent joint means that the bones really fit together like puzzle pieces. A less congruent joint is one where they don't really fit together very well. They're just kind of tenuously sitting next to each other. So that would be a joint that's not very congruent. So any forces that disrupt how well those bones fit together essentially could cause a high ankle sprain. So severity, like most of these types of injuries, they're graded 1 through 3, where grade 1 means that there was a sprain, so it was stretched but not torn. Grade 2 means there could be a partial tear, and grade 3 means it is completely ruptured. And that could be of either of our two tib-fib ligaments, or could also be the interosseous membrane. All right, so treatment and healing. So there's the usual first aid. So rest, ice, compression, elevation when it immediately happens. May be helpful to take anti-inflammatories and or pain relievers. And then depending on the severity of the injury, it might require a walking boot or crutches to keep weight off of it. And then as the injury heals, and especially depending on the severity and whether surgery is required, physical therapy will be likely. You have physical therapy to restore range of motion, strength, and balance. And once you're at that point, if you're going to physical therapy and it's no longer an acute injury, but now you're in the healing process and some time has passed, so it's no longer really as much an issue of inflammation, at that point, applying heat might be helpful before going to physical therapy or before doing your exercises, because it can improve blood flow, which is good for healing, and it can also kind of loosen things up a little bit and make your session more productive. But follow your instructions from your doctor. If they don't think heat is a good idea, then don't do it. And I specified later in the healing process because you don't want to apply heat when it is still an acute injury, because heat will increase inflammation. So if inflammation is still a big problem, don't apply heat. This type of injury often takes several weeks and to even several months to heal fully. And depending on the severity of a grade 2 or a grade 3 sprain, it may require surgical repair for the ruptured ligaments. All right, thank you so much for watching this video, and I'll see you in the next one.